includes 100,678 tests carried out yesterday. 246,406 people have tested positive, and that's an increase of 2,684 cases since yesterday. 9,408 people are currently in hospital with coronavirus, which is down 13% from this time last week. And I'm very sad to report that of those who have tested positive for COVID-19 across all settings, 34,796 have now died. And that's an increase of 160 deaths on yesterday. And it goes without saying, we offer our condolences to the friends and family of every individual who's passed away during this coronavirus pandemic. This is a challenging time, and as we chart the right course over the weeks and months ahead, our overriding priority remains to save lives, whilst also at the same time preserving livelihoods and allowing people to return over time, and as and when it's safe, to something resembling a more normal way of living. So on the 11th of May, we set out a roadmap to provide the information, the advice, and the reassurance to businesses, to public services, to other organisations, and to employees and citizens up and down the country. And I want to thank everyone who is making the adjustments and engaging with us in government to forge the path ahead in a sure-footed and sustainable way. Now, of course, we recognise that people have concerns, they'll have questions, and we want to work together with them and with everyone involved to provide the necessary confidence and reassurance in the next steps that we're poised to make. That approach is summarised in the slides, which if we could now have them up on the screen, please. And you'll see from slide 1, and as people will be aware, we've established a new COVID alert system with 5 levels, each relating to the current level of threat posed by the virus. The alert level is focused on the rate of infection, known as the R value, as well as the total number of coronavirus cases overall. And that alert level helps us to determine the social distancing measures that we need to fight the virus. So the lower the level, the fewer or the less restrictive the measures that we will need at any given time. And since the lockdown began at the end of March, we've been at level 4, as indicated on the slide. And thanks to the hard work and the huge sacrifices across the UK and the progress that we've made as a result of that, particularly in relation to compliance with the social distancing measures, we're in the process of moving from level 4 to level 3 on the slide. And we will do that through a number of very careful and deliberate steps. Slide 2, please. So you'll see that last week the Prime Minister set out the first of 3 steps designed to carefully modify the measures that had been put in place. And by gradually easing certain measures, we can begin to allow people to return to something resembling a more normal way of life. The choices we make, what we are asking the public to do and what we're asking them not to do, are designed to avoid the very real risk of a second peak that would overwhelm the NHS and, of course, risk turning a temporary economic painful moment for the country into permanent damage to the UK economy. At every step, we'll closely monitor the impact of easing restrictions and in particular the impact on the spread of the virus. And it's only by collecting and monitoring the data that we will be able to take the next step, which is indicated as step 2 on the slides, and that will be no earlier than June the 1st. Now, I understand it's natural for people to question why they can't do one or other thing now, why certain distinctions have been made. But in reality, you have to look at the package of measures as a whole, mindful of the risks to the R level and taking into account the various different economic and social effects combined. So we've adopted a balanced approach guided at all times by the science and, as I said, the overriding need to avoid a second peak that could overwhelm the NHS. Of course, it's true to say that making any changes inherently comes with some risk of spreading the virus compared to simply staying at home. But it's also true that staying in permanent lockdown is itself not sustainable on health grounds or economic grounds. That's why we've only eased measures where it can be done with the lowest risk possible. And that's also why we're watching the impact of every change that we make very closely. I know the last couple of months have been really tough for families, for businesses, for everyone up and down the UK. But it's only by keeping to the plan, sticking to the rules, even including when those rules change, that we will beat coronavirus for good. Slide 3, please. And that's why we've asked people to stay alert, to control the virus, to save lives, as we make changes to the measures in place in England and adjust the government's advice accordingly. Now, for the vast majority of people, that still means staying at home as much as possible. For those that can't work from home, they should return to work with the arrangements in place to ensure that it can be safely and responsibly done. We've also adjusted, as you can see from the slides, the advice to allow people to exercise more, to visit public outdoor spaces, but staying 2 meters apart from those outside their own household. And as ever, people need to keep washing their hands regularly and carrying out the hygiene measures that we've advertised before. Our advice is to wear a face covering when you're outside the home in enclosed spaces and where it's difficult to socially distance, for example, if going to the shops or traveling on public transport. And if you or anyone in your household develops symptoms, then you still all need to self-isolate. Now, while we're asking the public to do these things, we in government will keep ramping up the effort that we need to see to get the UK back to a more normal way of living. And with that in mind, today the Health Secretary announced that anyone in the UK with COVID-19 symptoms can now get a test by booking online. And I can also report that we've recruited now over 21,000 contact tracers and call handlers in England for the implementation of our test and trace programme. That programme is absolutely key in the next steps that we need to take as a country to come through this pandemic safely and responsibly. Jonathan, if you'd like to run us through the latest data.
Thank you, Secretary of State. Good afternoon, everybody. I've just got a few data slides to show you in the normal fashion, beginning with this one, which shows you Apple Maps searches for directions. So it is confined to Apple users, and it shows the beginning of the period of lockdown on the left on the 23rd of March, and what has happened to searches for walking instructions, driving instructions, and public transport from that point until the very recent past. And you can see that there has been a gradual, but only gradual, upward trend in searches related to walking and driving. But for public transport, this trend is essentially flat. And this is very much in line with the guidance that the government has issued about avoiding public transport wherever possible, saving it for key workers. And clearly this is a trend that the public are following. I've shown you the two data points on the right of the slide before now, that compared with last year, 44% of adults are working at home in the period 24th of April to the 3rd of May, compared with 12% at the same time last year, and that 80% of adults report they have either left the home for permitted reasons or not at all in that period. Next slide, please. Moving on now to testing. These data are correct as at 0900 hours this morning, and they relate to tests processed and sent out. And the broad message is that we are continuing to test at the rate of around 100,000 tests per day, and that in total almost 2.7 million tests have been used since the crisis began. And in terms of confirmed cases, the data as of this morning were overnight for 2,684 new cases, out of a grand total of diagnosed cases of just under 250,000. But what you can see, if you look to the bottom right-hand corner of the slide, the green bars, you can now see a definite and sustained decline in new confirmed cases, which continues to be encouraging. Next slide, please. So these are data I showed to you last week, updated, of course, data from hospitals. The top curve relates to estimated admissions with COVID-19 in England, 604 78 is the latest figure, down from 701 on the 9th of May. So again, steady declines, and you can see that in the top blue curve. Turning at the bottom of the slide to the percentage of critical care beds currently occupied by COVID-19 patients, this trend is also consistently down across the 4 nations, and currently the figure runs at 19%. Next slide, please. And then this slide also relates to hospitals. It relates to all of the UK, and it relates to the total number of people in hospital with COVID-19 over time, updated as of the 17th of May. And what you can see here is that everywhere, the numbers of patients in hospital with COVID-19 is now in sustained decline. Again, very good news. And the final slide, please. This is the daily deaths data. These are deaths confirmed with a positive test in the UK. As of the 18th of May, we are reporting 160 deaths and a total of 34,796 with a positive test. What you can see, and again it remains the most important thing to look for, is the overall long-term trend as illustrated by the orange line, which is showing a consistent and solid decline as the days and weeks roll by. Thank you, Secretary of State.
Jonathan, thanks very much. We'll open it up to questions, and I think there's one from David from Bury.
Good afternoon. As we take the first tentative steps towards releasing the lockdown, when will the government outline the roadmap ahead beyond the pandemic to ensure a swift fiscal, health and well-being recovery? And what has already been discussed and decided?
Well, thank you very much. It's Danny from Bury. I'm terribly sorry I had David here. Danny, we've already published over 50-page roadmap to how we rebuild after coronavirus. And that includes the 3 steps that I set out on the slides. The key thing, and there are different measures at different stages relating to no earlier than the 1st of June, the phasing of reopening of primary schools, different issues for businesses at different times. So non-essential retail will be dealt with at that point. But whether it's the 1st of June or the 4th of July or any subsequent steps, we will only take those decisions and take those measures based on the scientific advice that tells us we can responsibly do so. And I think the worst of all worlds will be to trip up now and to stumble when we've made the progress that the Deputy Chief Medical Officer has set out very clearly. So we'll be guided. We set a roadmap, but it's a conditional roadmap, and we will monitor very carefully based on the changes that we've made over the last week and see what impact that has. And we will assess where the R rate is and the other coronavirus data is before taking any subsequent steps, no earlier than the 1st of June. Jonathan, would you add anything to that?
No.
Danny, thanks very much. I think there's one from James from Wittering. James asks via text, is the government preparing for a second wave on PPE, ventilators, testing, etc., so all the issues of the first wave won't happen again? And well, I'll let the Deputy Chief Medical Officer comment, but one of the key things we've said all along is, first of all, that we're going to be very mindful to avoid a second wave. We want to keep the R level down, the rate of transmission down, to avoid that. And we do not want, and we will not sanction measures that where we fear or there's a risk that they would take us above R1. At the same time, when we set out our 5 tests for easing the lockdown, and they still in large part apply, one of the key things is that we wouldn't take measures until we're absolutely confident that we've got all of the capacity we need in the NHS. One of the things that we've done, and it has been effective, is we've made sure that at every step the NHS has not been overwhelmed. And in particular, the critical care capacity that Jonathan showed on the slides has not been overwhelmed. And it's not just good enough to do that day by day. We want to make sure that with any steps we take in the future, that remains the case. Jonathan, what would you add to that?
Thank you, Secretary of State. So I would add that we're absolutely not hoping not to have a second wave, and that is one of the reasons why we are being so careful about unlocking social distancing one piece at a time, because we absolutely don't want this to get out of control again. However, is it right and proper to prepare for emergencies? Is it right and proper to put ourselves in a good position to be able to deal with an upsurge of cases? Absolutely. And let me emphasize a couple of things here. One is that maybe people are just hoping and praying that this virus will just go away, as indeed I hope and pray it will. But the reality is that certainly until we get a vaccine, and only if we get a vaccine that is really capable of suppressing disease levels, will we ever be what we would call kind of out of this. And so from that perspective, we may have to live and learn to live with this virus in the long term, and certainly for many months to come, if not several years. A vaccine may change that, but we can't be sure we will get a vaccine. The other thing to say is that this virus is a new virus. We don't fully understand it. We don't understand something called seasonality. And one of the things that's very clear, for example, with flu viruses, is that they come in our cold winters, and the levels of transmission and circulation decline over the summer months. Now, the data we have on other coronaviruses, we've looked at very carefully, and it is not clear that these coronaviruses are as seasonal as influenza, but there may be an element of seasonality, and it may well be that the autumn and winter conditions provide a better environment for the virus to then do its work again. So we have to be very cautious about that and plan for these kind of healthcare surges that we hope we don't need, but we want to be ready for them if they happen.
Very good. And thank you, James, for your question. We'll open it up to the media now. And I think we've got Fergus Walsh first from the BBC. Fergus, over to you.
Thank you. You've just added loss of taste and smell as a key symptom for coronavirus. France advised people back in March that if they lost taste or smell, that they should self-isolate. Hasn't the UK been very slow to act?
Jonathan, I think that's probably one for you as
yes, thank you, Fergus. We've been very careful about looking at the data on anosmia and looking to see if adding it to the case definition would change something in terms